next week.
Should be. It said
Oh, you want an ID?
he was asking to be admitted.
Yeah.
Okay. Call to order the committee of the whole meeting for April 28th, 2026. First agenda item is roll call.
Barraza. Lancy.
Here.
Beck.
Here.
Malay.
Here.
Malone.
Here.
Sofa.
Here.
Wolf.
Here.
Barron.
Here.
Lehman.
Here.
Lohman.
Here.
Keeper.
Here.
Fehrenbach.
Here.
Okay. Anderson.
Here.
White.
Here.
So that's 13.
Okay. Jim, is there any way you can turn the volume up at all for you?
Yell at your car.
Yeah, in about 5 minutes. I'm actually not playing this time. So you give me 5 minutes.
Okay. Thank you. Reminder to please speak into the microphone for the BATV recording broadcast tonight. Item 3 is items to be removed, added, or changed. Do we have anything? Anybody?
You've got an executive session, right?
It's on there.
Yep, purchase real estate. Got it. Anybody here for matters from the public for items not on the agenda? Seeing none, we will move directly into the consent agenda. Baron.
Thank you. The consent agenda reads as follow. Approvals. Approval late night liquor license for Comedy Vault LLC doing DBA Comedy Vault 18 East Wilson Street. Resolution 2026-52-R authorizing execution of Task Force Number 18 with Alan Peppa Architects for exterior masonry pointing and masonry repairs, gutters and downspouts. Ordinance 2026-15, amending the official zoning map for 17 Carlisle Road. Resolution 2026-54-R, grant of subdivision variation, 644 Midway Drive. Resolution 2026-56-R, authorizing execution of a contract with V3 Construction for the maintenance in natural areas. Resolution 2026-55-R, accepting a plat of dedication and easement at 329 South Harrison Street. Ordinance 2026-16, variance for a deck attached to a principal and accessory structure. Angela Kale, applicant. I move that we approve the consent agenda as read.
By Baron, seconded by Solfa. All those in favor?
Aye. Aye.
Motion carries. Okay. Move right on to the regular agenda. I'll start off with 6.1, discussion on Tri-City Ambulance. Alderman Malay, did you want to start this?
Yes, I think the chief was going to give a presentation.
Okay. Sure.
All right, I was just asked to do a brief overview 3 years ago. I did the same thing, so we have some new council members, so I'm just going to run through it real quickly. Won't take much time. So originally, the EMS was a hospital-based system. Ambulances came out of the hospital here in the Tri-Cities prior to the formation of Tri-City Ambulance. Once that system started to falter, and the mayor could jump in anytime he wants because he was involved in it, falter because of some financial situations and problems, primarily in Geneva Community Hospital, they came to the local mayors to try to resolve or continue the ambulance service through the Tri-Cities. It originated because the PSAPs, or what's known as basically Tri-Com and Dispatch Center services, consolidated in 1976 through the Tri-Cities. So they were originally answered at all 3 police departments, consolidated into one 911 group out of Geneva, and that had been such a successful model, they were looking to do the same thing for the ambulance services. So, as I said, the ambulances at that time, there were only 2, operated out of Geneva Community Hospital, which was downtown Geneva on 3rd Street. If you know Dotson Place, that's where that was. And Delnor Hospital in St. Charles, which was up on North 5th Avenue, 975 North 5th Avenue, which is Delnor Glen up there now, senior living complex. 1982, essentially, the mayors got together, and the mayor can elaborate if he wishes, and through some discussions and things, worked out an agreement with the Tri-City Ambulance. And the idea was to move the ambulances into the fire stations. At that time, each department had 1 fire station. So it was really simple. And because there was only 2 ambulances, they were going to now extend service to Batavia. And in doing so, St. Charles ended up with 1 ambulance with 2 paramedics. Geneva and Batavia had an ambulance each with 1 paramedic on each, and then an EMT to supplement that ambulance at the time. In May 1985, finally, there was an original intergovernmental agreement formed to cognify all those decisions. All this came under what's known as the Southern Fox Valley Emergency Medical Services System back then. Whoa, this thing's touchy. So TCA now operates 6 ambulances, 5 primary ALS units, which are staffed 24/7, 365, with 2 IDPH licensed paramedics. So they all have paramedics now, 2 on every ambulance rather than 1 and 1, which falls under IDPH Region 9, which is kind of the north portion outside of Chicago of Illinois. And that is housed basically up out of Elgin, is the primary headquarters for Region 9. We now have, rather than 1, because of this addition of fire stations and demand due to population growth since 1982, we now have 2 ambulances in basically all 3 towns, but 2 here in Batavia, 1 at each fire station, 2 in St. Charles on the east and west side, and they're station 2 and 3, and then 1 in Geneva on their headquarters station on East Side Drive on the east side. But then we run what's called an ALS demand unit. If you look at our call volumes and things, which I could bring you a chart or we can get into most of our call volumes is because of surge population. Shopping, people come into town to work and do other things. So we run that ambulance from 8 a.m. to 5 p.m., 9 hours, and it's located out of Geneva Fire Station 2. That ambulance, as I said, serves as a surge, and it's what we call a floater, generic term. It moves from town to town. So both of our ambulances are out. It'll shift to Batavia Station 2. If both St. Charles's ambulance are out, it shifts to downtown St. Charles Station 1. Other than that, it's either at Station 2 in Geneva, or most of the time they're in the hospital, and they'll run from the hospital as they become available as we get busier and busier, depending on volume for the day. The map just basically outlines the 3 areas. The area off to the south here, that purple area shows you Elburn's district, and you'll notice that little area there is Mill Creek. Right? While it has mailing addresses in Geneva and Batavia, it's not served, obviously, by Tri-City Ambulance, and the area down on the bottom of the map is North Aurora. So that kind of gives you your borders. Obviously, Fermilab is the big white section off the north side of the map, and the upper section is now what was St. Charles. We used to serve all that, but it became part of Fox River Fire Protection in May of 2011, and they disconnected from Tri-City Ambulance at that time. So just reminding that Tri-Com Dispatch Center still remains a PSAP. All these units fall under that 911 center, so they're all dispatched locally through Tri-Com. And then the fire departments, we provide the backup service with our fire engines, our ALS equipment, and any BLS non-transport ambulances units like our squad currently, which we're looking to upgrade by the end of the year, hopefully into an ALS unit. But there are Geneva and others we have some BLS units that go when we run out of ALS units. Or if it's a lift assist, a BLS call, nosebleed, headache, something that doesn't require advanced life support, we'll run that unit instead so we don't tie up our ALS engines. So those apparatus, though, carry the same equipment as our ALS engines. So they have jump bags, oxygens, cardiac monitors, CPR, automated CPR equipment, things like that you would have on the ambulance for initial. They just don't have the extensive amount of equipment that an ambulance would have. So because of that, we have the ability to quickly restock on the scene. As I said, the ambulances have 2 to 4 times as much of everything, just in case they need them for multi-injuries, multi-patients, or they don't have the time to restock before they get back. So we restock, we being the fire department, will restock off that ambulance at the scene, and then when the ambulance goes to the hospital, it's able to restock at the hospital, and then that equipment then gets billed to that patient when we drop the patient off. So that's how the equipment gets paid for that we use to treat people. We don't actually bill them for the medicine, the bandages, or the supplies used to treat them. They're billed through the hospital because they're replaced by the hospital. Nice thing about Delnor Hospital, from times ago, it is centralized now, right on Randall Road. We all know from the studies, it's one of our busiest corridors. So it really works out nice for us. And the Southern Fox Valley EMS system is now located at Delnor Hospital right there. So if there's problems, concerns, they monitor, they could come up and we can deal with those issues right at time. And as we said there, we fall under Region 9, but there's a number of us that are on the board of Region 9. So we have an active participation in Region 9. Oop. Okay, so Tri-City Ambulance Board is comprised of a 7-member board, 2 members from each of the authorities, Batavia, Geneva, St. Charles. Here we have Mayor Schelke, who's been on since the inception. He's our chairperson, and Alan Wolf, who's also on the board. We have 1 trustee from the Batavian Countryside Fire Protection District. They're the only district that's still left. All 3 communities used to have a district on it, but Batavia Fire District's the only one left, so we still have Gene Olmstead as secretary from that board that's on our Tri-City Ambulance Board. Those appointments are made by each of the mayors in those communities, and the Township Fire District appoints their own individual from the board. When this was set up, initially Geneva was the lead agency of TRICOM, and through the different agreements, intergovernmental agreements that the mayor can expound on if he wishes, City of St. Charles became the lead agency in 1982 when they started, and is responsible for the day-to-day management, which means they lead all the purchasing, they manage the budget aspect of it, all funds are run through their finance department, utilized for TCA. But we now have a supervision of a Tri-City administrator. A number of years ago, our call volume got so extensive, we needed an administrator, almost like a chief, to oversee that operation, because they run almost 10,000 calls throughout the Tri-Cities for a year. So with that, though, there's staff advisors that help that TCA administrator, works to advise the board and help make some of the policy decisions and day-to-day operational decisions, which are comprised of all the fire chiefs, myself, Geneva's Chief Antonori, and St. Charles Chief Moffey, in addition to that Tri-City Ambulance Administrator. So, like I said, the finance department is the lead agency. They take care of the investments, capitalizations, purchasing, policies, everything is done through them, and it's audited just like any governmental entity. The budget expenses are met basically through billing revenue is the primary source of the funding that operates TCA, but there are some additional member assessments that are put on each agency to make up some of the balance of funds necessary. So example, this year, cost 2026, member contributions for the whole Tri-Cities and Batavia, it adds up to about $500,000, $505,329 as I indicated on there. Our portion of that contribution for this year, for the whole year, is $176,866 to run Tri-City Ambulance for the city of Batavia. Ambulance billing is done by a third party also. It supplements the cost of providing that ambulance service. Residents are billed at a lower cost than non-residents. The thought process, the mayor can also add on, that's direction from the board, is our residents already pay taxes, they pay fees and things, and it's not what we call charge them twice, essentially. So outside, non-residents pay full cost basically, and residents basically pay what we consider a calculated balance of between what does the tax portion and service costs. That billing, like I said, is done by an outside agency, and collections are also handled by a third-party outside agency. Personnel costs, the only personnel actual employee of TCA is the Tri-City Administrator, who is technically an employee of TCA, but is paid through the City of St. Charles. No different than TRICOM, who are a separate board, separate entity, and separate employees, but are paid through the City of Geneva payroll system in order to be part of IMRF and benefits and everything like that. But the other personnel are provided through a contract with a private vendor. There's no employee-employer relation specific to, we don't pay their benefits, we don't give them health insurance and those aspects of it. We don't manage their HR aspects and things like that. So that's what's meant by no employee-employer relationship. We don't have the overhead costs of managing those people other than directing them on calls, incidents, and overseeing their care and capability. Salaries, including overtime, like I said, benefits, all that is handled by the vendor. And it's we get a one fee for the entire contract of 33 personnel, and we don't decide how much each one is paid or how that pay structure works. Currently, the contract that we're under was completed in May of 2024. It's a 3-year contract. It's been average, basically what we've seen as an average with that third-party vendor, and it'll expire this next year on April 30th and 2027. And the vendor is paid monthly. We get a monthly invoice from that vendor, and that's how they're paid through St. Charles. Those contracted medics are quartered in the same fire stations as our fire personnel. And like in here in Batavia, they are uniformed the exact same way. They sleep with us, eat with us, and are basically the same, just a part of the team, part of the crew. You walk into the station and you really don't know whether they're one of the contract medics or one of the firefighters. Different fire departments are operated a little bit differently. Like I said, here in Batavia, we're uniformed the same. In Geneva, they're uniformed the same, but they also do perform firefighter duties, whereas in Batavia and St. Charles, they do not. And St. Charles, they currently are also just paramedics and wear a Tri-City ambulance uniform rather than the fire department uniform. They all participate and are required, as every paramedic within the system is required for EMS training under IDPH. That training is done by Southern Fox EMS system and managed through IDPH. The challenges with it are sometimes that they're not our employees. And that when you get into certain entities of records, discipline, even personnel matters, health concerns, things like that, accidents, we don't manage that aspect. We have the TCA Tri-City Regional Administrator person who works out of St. Charles. That's not the Tri-City Administrator, that's PSI's oversight administrator for all Tri-Cities. And then each Tri-City entity, I think I have it on the next slide, provides a coordinator at each department. And then we have our oversights. An example would be one of the PSI personnel gets hurt. We still have our lieutenants, our battalion chiefs and things. They're immediately, they're on the scene usually. They're notified. They notify the coordinator, notifies. I get notified on any incidents within the fire department, accidents, injuries, no matter who it is, civilians or not. and they notify the regional, PSI regional coordinator, and he then takes care of that. But we make sure, just like we do with anybody, they get immediate treatment and care. So the primary responsibility for that is still under their privy, but it is honestly under every fire chief, just like fire operations and everything. We oversee all of that. So the nice thing is Tri-City Ambulance is an accredited agency, and I'm proud to say have been for many years, and they just received their re-accreditation like a month ago, and they're very excited, and that's a 3-year accreditation. So kudos to them. Looking ahead, we're going to need additional resources. Service demands continue to climb, especially in EMS. You've heard me here before preaching the need for an ALS squad. With our call volumes and aspect, we're going to need that. Whether or not Tri-City Ambulance, and there's been a lot of discussion, adds a 7th ambulance or what they do will be up to TCA at that point. But more shared services, more paramedics is something that's discussed through the TCA board. The only other thing I would say is IDPH. We did get a accommodation for our cooperative intergovernmental agreement for the Tri-City Ambulances, which is a unique operation within the state of Illinois. Not many have that, and we were, by Lieutenant Governor, I can't even say it now, to say Evelyn, we're recognized for our successes in those shared costs and services. And I'm sure the mayor could answer any of that. So if you have any questions, it's a quick, fast overview. I'm sorry to take so much. I'll work on talking faster. Be happy to answer any questions you may have.
Questions?
Yeah, well, I have some comments and some bullet points to bring up. One clarification, the coordinators they're actually the paramedics that serve as both a paramedic and a coordinator?
All the coordinators, all personnel for PSI are required to be paramedics, yes.
Okay, so those...
So the coordinators are paramedics, even the regional regional administrator out of TCA and out of PSI are paramedics. Even I'm a paramedic. Right, so yeah, we're all paramedics.
Okay, and then you said 33 paramedics. The contract says 32.
They added that TCA regional administrator to oversee all 3 of the contracts this last year at their cost.
Okay.
Without any increase to the contract.
So they're not serving as a paramedic in...
He does serve as a paramedic. Neil was there before, and this is Greg Johnson. He was the coordinator at Geneva. He was promoted up to the regional, and he jumps the ambulance if someone gets sick, injured, or calls off sick. So we don't lose an ambulance.
Oh, he's a sub, so...
He is
So
not
on
a sub,
every-
he's an administrator, just
Okay.
like me. If I have to jump
Okay.
an engine, or I've jumped the ambulance, everybody's like, oh my God, the chief's on the ambulance.
Yeah, that's
That's an interesting day when that happens.
yeah, and that's a good segue here.
Okay.
So I've prepared a little research. I've been digging into this. It's no secret that I've been very interested in this for a decade now. As long as I've been on council, I've had an interest in this. Issue has come up multiple times. And I've yet to be convinced that we're doing the best for our community. Now, what you shared, the vast majority of what you shared, I fully support. I think Tri-City Ambulance, that shared services is fantastic. It works very well. The problem I have is when we start contracting our services out. And so let me just get into this. The points I want to make, I want to just touch on a little bit of history, some quality concerns that I have, transparency, and the TCA budget, which thank you, Alan, for providing that. I was unable to find a lot of that stuff myself online, but Alan was able to get me the recent contract and the budget. The strategic plan for our fire department, and finally the actual contract that TCA has with Prairie State. I'm sorry.
PSI.
PSI,
paramedic
thank you,
service.
thank you. Okay, as you know, this council here, we are ultimately responsible for the ambulance service that's provided to our community. You know, the decisions, you know, we are the ones that make the decision on what arrangement to follow to have ambulance service. As you know, this arrangement has been in place for over 4 decades. Back in 2023, some of you were here, some of you weren't. The city received a letter from the Batavia Professional Firefighters Local 3436, basically informing us of the ambulances going unmanned because of a lack of employees, turnover, a number of things. The city responded with a letter, and the firefighters who are all required to be paramedics. You know, our firefighters are required to be paramedics, so they have the certification to man the ambulance. They said, "Hey, we can help and support the city when those brownouts happen, when the ambulance brownouts happen." And the response that they got back from the city, you know, understandably, was, you know, explaining that coming out of a pandemic, you know, the healthcare field, you know, suffering, lack of providers, for especially first responders. So it was a difficult time. But more importantly, we had to let them know, thanks, but no thanks for your help, because we have it's contracted through a private service. So even though we own the ambulance and you're our employees and have paramedic license and we pay you for that, you can't do that for insurance reasons.
We don't own the ambulance.
we don't.
It's owned by Tri-City Ambulance.
Which we are a owner of Tri-City Ambulance, right? It's an intergovernment agreement, right?
Right. We are
Okay.
contracted to it.
Yeah, so we are part owner.
Tri-City owns it.
We are part owner of Tri-City.
Okay.
That's going to be part of my point here. The response we gave, you know, we had discussion on this council about this at the time. And again, it was the response that I got when I was asking questions was it would be too expensive. The pensions, the hiring our own paramedics. So, okay, this has gone by. That was in 2023, we had that discussion. Over the last few years since then, we've heard the mayor talk continuously about the increase in service calls, and 70% of those service calls being ambulance calls. So the volume has gone way up. So in my head, what I'm hearing is, all right, more calls, we charge fees per call, revenue's up, let's look at the numbers. I've been yet to see that until just now, or more recently, I've taken a deeper dive. So in response to that, not being able to man the ambulances, you know, we had a contract and they were in breach of contract, PSI was, because they weren't providing their share of paramedics, that the contract that we paid for clearly. So in response, they were, you know, to be able to hire more people, they increased their starting wage, and they advertised this. I have a Facebook post on it that they put out at the time, and increased the starting pay by $15,000 to $80,000, which exceeded our starting pay of firefighters. They also gave a $10,000 signing bonus. So that, you know, they were able to bring more people in. But then comes the quality concerns that I have. With that, you know, they hire paramedics, and it seems to be a revolving door because the turnover rate has been significant. Since 2020, I'm told, now I've asked for this information from the city, but apparently that detailed information is not kept. But I have been informed that since then, since the year January of 2020, there have been at least 77 paramedics that have been assigned to work in Batavia. Imagine that turnover rate that's happening. There's 12 paramedics assigned to Batavia. Imagine if that had happened with our fire department, with our firefighters, that kind of turnover.
It actually does,
No.
Tony. I would compare it.
Can I please finish?
Okay.
Yep. Thank you. That turnover rate I find very concerning, and we do not have that kind of turnover rate with our firefighters. That is, that just doesn't happen. I know many of the firefighters that have been on staff for years, and I'm not seeing a bunch of new faces. In fact, we swear in people that are new right here. So, currently, I'm told we are down 2 paramedics. And I would point out that while it's not happening right now, but when they've been short in the past, they've switched to a model where it's 36 on, 36 off. The contract calls for 24 on with 48 off. Now, if you're an employee, a paramedic, and you're told you need to work 36 hours on, you get a day and a half off, and then you'll be back on for another day and a half, that's stressful. That's not, I'm concerned about that, about the quality of care that's given when that kind of system happens. The contract also allows our chief to require all the paramedics that are assigned to Batavia to be firefighters. Geneva does require that. Now, I said before, we require our firefighters to be paramedics. But for some reason, we've just decided, and I've got Craig, Chief Hansen did give me an explanation, not to say, I'm not convinced it's enough reason to let the contractor off the hook from providing a more qualified personnel, which the contract allows us to have. But 3 years ago, we said, you know what, you don't have to be firefighters anymore. Just send us paramedics.
I made that decision, Tony.
Yeah, I know. You told me that. I appreciate that, Greg.
No problem.
Yeah. I would also point out the employees of PSI, while they start at $80,000, they don't get a raise annually. According to what the firefighters I know that work alongside with them, they are fixed at $80,000 a year. So you can imagine that causes turnover when you don't get an annual raise. The cost of living goes up. You're underwater before too long. So that raises concerns about quality. They also get 1 sick day for every 6 months. So imagine that. You're really sick. You only get 1 day. You're going to come to work? Probably when you're sick. Again, quality concern. Vacation time, 1 day per year. Period. People need time off. That's not conducive to a workforce that's going to be fully committed and providing the best quality to our community. Then there's the whole issue. They work side by side with the firefighters, with our employees, and because it's a revolving door, there's always often questions about what kind of confidence they have in this new person that just showed up that's maybe never even been in Batavia before. And again, a couple weeks later, could be someone else in there. There's also concern about, the quality of care that they provide. If they're, just a paramedic, and how much experience do they have? And we know that this contractor has contracts with cities all across the area. When someone's not working out in one city, you can't tell me that they're not sending them to another city, because they're a body that has a paramedic's license. Is that the best we can provide for our community of Batavia? I think not. And then complaints. In fact, we got a potential litigation threat happening about an employee of that company about a complaint. So definitely some concerns I have with the quality of ambulance service that we're providing to this community. And again, we as this council are responsible for deciding how that ambulance service that we provide arrangement happens. Just because it was 40 years ago that the council did this, and we have renewed the intergovernment agreement, which I've also have been unable to find. I do recall one time at least being on council that we did restate that, but you would think that would be available on the website, which leads me to the next thing on transparency. In doing all this research, looking through, I had to ask for a number of things. A number of things have not been made available yet, but I'm told they're coming. One of them being the intergovernment agreement. Was told I would be given that, and the council would be given that, and we haven't seen that.
I thought that was the new, you have the
That's I
current
recently asked
agreement?
for that, and I was told it
I
would be.
sent an email out today with the former contracts.
Yeah, but I had asked for the intergovernment agreement.
I'm sorry, you're not talking about the PSI contract.
Talking about the IGA. Which I think is very important that everyone on this council knows what that IGA says. That's because that's where we give our authority to TSA. Now, we still can have control, our share of TSA, but that intergovernment agreement, if everybody hasn't seen that, that's a big problem because that tells me that not everyone's fully aware of the arrangement that we have. The other transparency issues, Craig, or Chief Hansen, I'm glad you mentioned. Yeah, I'm glad you did mention that St. Charles no longer lets them wear the city uniforms. We do. So we have paramedics that are not our employees, they're contractors that wear City of Batavia uniforms. They have IDs that give them access to the fire stations that are City of Batavia issued IDs. They have City of Batavia email addresses. So my point is, you would think that they're city employees. Our community is led to believe that they are city employees. They got our uniforms, they got our IDs, they got our email addresses. I would think that is the case. But they're not city employees, and our community doesn't know that. And I've said this multiple times here. The idea of, the most vital service that we provide as a city, in my opinion, is the ambulance service. In your hour of greatest need, you make that call to 911 and you expect an ambulance to show up for yourself or a loved one in a desperate situation. And you're led to believe that it's an employee here, an employee that gets a pension, an employee that gets the same benefits as the receptionist, an employee that's valued by a employer-employee relationship. But that's not the case. But again, the transparency piece on this, we get our property tax bills, which they should be coming out real soon here. There's a line item on there for Batavia City pensions. So our taxpayers who think that the paramedics are employees of the district see a line item and they're probably thinking, well, I'm probably contributing to their pensions too, but that's not true. So it's a little deceptive and not transparent, I should say. And again, finding agendas and minutes, some minutes were there for meetings and some weren't. It was hit or miss as I went back through the last few years. And that's all maintained on the St. Charles website. Correct, as lead agency. Which leads to the next thing I want to talk about, the TCA budget, which, thank you, Alan, for sharing that. I asked that to be shared with council too, but I don't think it made it out. It's basically a page that was just approved. But very interesting. Obviously, the big item on there in terms of expenses is for PSI, the contractual field personnel, which this year that's just ending in a few days here, April 30, we paid over 4.7 million. And next year it will be 4.9 million. Now that's TCA paying to PSI for them to provide 32 paramedics. All right, the other couple other big items on here, professional service was 275. The current year the budget is going up to 285. I believe that is for the billing service. Those professional services, yeah, I assumed that. But going on here, and then obviously the TCA administrator costs are all on there. But then there's a section as part of the expenditures for write-offs. And Alan, you've talked about this. You're right. The write-offs are enormous. I was shocked to see that.
That was the first thing, the day one that I went in there
Yeah.
just blown away by how much gets written off, but that is almost nationwide for any ambulance service.
Yeah.
Anytime an ambulance is run.
So what I believe, what I think, the overall budget for Tri-Cities is like over 17 million, but almost 10 million, next year it's projected to be over 10 million, is write-offs. That's for bad debt for each of the towns, and then Medicaid write-off, Medicaid, Medicare, or Medicare, Medicaid, which makes sense to me because Medicare has caps on what they'll pay. So put a pin in that a second. So in that budget, there's, it's a $17 million revenue, but then write-off is 10 million. So we're roughly $7 million to deal with. And almost 5 million is going to go to PSI for the coming contract. And then the other 2 million pay for the administrator, the billing service, a number of maintenance on the equipment, all legitimate expenses. The reason I bring up, Mayor, you're always talking about the 6 senior living places in Batavia. And we've had discussion about this before, about those senior living places, instructing their employees not to help people that have fallen because they can call the ambulance to do that. And this council decided we were going to levy a fee. Do we collect those fees?
We were going to coordinate with the other 2 communities on that. Can you provide an update on that, Chief? Sure. So that we're all doing it at the same.
Recent legislation, which was just passed in January, now allows for the state, through state statute, for us to levy those fees. We did, as you remember, Tony, you've been on the board for a little while, we tried to implement those at a local ordinance and fees and ran into some complications and same problem.
I remember.
Same problem we have in other collections aspect in collecting those fees,
Yep.
especially at our nursing homes and facilities, because the residents are in there. They've turned over all their property and expenses to that institution. Yet we're billing them individually, and those are fees that cannot be billed to Medicare or insurance. They're out of pocket.
The institutions were passing them along to the residents.
Yeah,
That's what was
because
happening.
my thought or my understanding when we did this was we were going to assess it to the property owner, to the.
But they pass it through to the
They pass
resident,
it
and we
on.
can't
Okay.
stop it.
So that, we as a council agreed to do that, and I don't recall getting any feedback after we passed that ordinance that didn't happen.
That was
And
during
couldn't
Randy
happen.
Dykey's time.
Under Chief
Yeah,
Dykey.
so it's been a little while, and I understand it, and so
5 years.
again, transparency.
But there is a plan to put that back in
Yeah,
place in
okay.
coordination with the other
All right.
cities.
But again, I'm talking about transparency. But the idea of all this senior living, it makes sense that the vast majority of our ambulance calls are for people over 65. Would you agree that that's the biggest population that we serve through the ambulance?
Our largest single call volume is to the homes.
Yeah. So, that we know the rates that we get are much less than that. And I get it. Personally, I think it's a problem that the Medicare's for some of our most well-off people, but the people on the bottom don't get any single payer, but I won't go there. But to me, that sounds problematic because if they're doing the bulk of the calls, but they're paying the less, that puts the burden more on our community, on our people that are under 65 that have to use the ambulance service. And actually, just recently, a couple weeks ago, there was a special meeting of the Tri-City Ambulance to increase, it was a year ago that was done. The City of Batavia webpage shows the rates from last year. So it's a little deceptive because currently our Batavia website does show that the rates that were effective starting in 2020, a resident for basic life support is $13.73. The new rates that were put in place a year ago, May 1st, last May 1st, went up to $2,400. So from 13 went up over $1,000, like $1,079 for that fee. But we know full well we're not going to get that fee unless you're under 65 and not on Medicare, and it's not a fair system is my point. Again, I want everyone to be fully aware of what we have here. So that you would think that fee increase would have been reported to the council because again, we are the ones responsible for deciding what kind of ambulance arrangements we're going to have in this city. But again, there's transparency that I stumbled across that going through agendas. And then looking at the web page for St. Charles to see their fee structure didn't match ours. And I thought, oh, ours is a year old. No wonder. And then I found that. All right. So it also, in the budget, the minutes from the December meeting showed that there was going to be a $352,000 surplus to reserves. The question I have is, I saw nothing in the budget about any reserve amounts. Is there a reserve?
Yes.
How much is that, and where can I find that information?
Send the budget to the entire council. What appears that the budget you have is basically ledger slate, which is operations. You need capital and reserve, which is no different than the city's aspect. You know, we have capital funds and we have reserve funds. So I can provide
what's the ballpark of the reserve funds?
I don't have it in front of me.
Yeah.
I don't want to.
Are we talking
misspeak? But the reserve funds have been building as they have fortunately in Tri-Com and in the city of Batavia, and the board, Tri-City Ambulance Board, chose to do the same thing that both the city, yourselves did, and Tri-Com, and that's to spend it down to closer to the state statute requirement of 3 months of operational expense. They were approximately, I believe, 6 months of operational expense. The board was not comfortable with it. Was recommended by one entity that we do a complete spend down to a zero, which we could have with that, but the board wasn't comfortable with such a drastic, not knowing the current economic environment, and they chose to do a 3-year spend down. So that is what's occurring, and now you're seeing you'll see less input or assessment fees to the city of Batavia for the next 3 years.
And your one slide showed that you were at, I think it was 535,000 was what was going to be assessed to the 3 cities, and the next year,
and
the next year was going to be down to 167. Was that because of
160? Yeah,
that
we're
reserve
spending down.
Yeah. So the city
board,
costs. So our
right.
city costs, if it's a third of that, we're talking $60-some thousand.
Well, no, with the 550 or 505, that was the total of the 3. We were at 176. I think was our last cost.
But is that including that spend down, the third spend down?
Yes.
Okay.
So that's why it's so much smaller. It used to be closer to a $500,000.
The spend down also was approved at the end of the year 3 is they will explain we will no longer contribute. It'll be a zero.
Okay.
Zero net cost to the city of Batavia for Tri-City Ambulance.
Oh. And that's a good thing for Tri-City Ambulance.
Under the transparency, we became so efficient, the GEMT, which is the government subsidy for the ambulance, is no longer required. So we no longer get additional government subsidy because we operate so effectively and efficiently, we no longer meet the threshold for it.
Okay. All right, then moving on to the strategic plan. Back in 2024, I think it was shortly before that, we approved the fire department strategic plan. And this was like a year after we had the conversation. I kept bringing up this issue. And I was pleased to see in the strategic plan that there would be a evaluation of the cost benefit of in-housing the ambulance. When I started digging in here, I went, well, I recall that strategic plan. I want to go look at that again. I couldn't find it. Nowhere on our website. So I emailed Chief and Max got back to me promptly with the strategic plan, which had been updated. And I looked at that line item that the evaluation cost benefit of in-housing the ambulance service was completed. And we were told nothing about that. So the line item says, evaluate cost benefit of in-housing ambulances. The impact is high, resources required are high. Target year 2026. Cost benefit is evaluated, completed. And so when I look at the outcomes of this, it says we understand its financial impact versus limited workforce availability. We can provide full service EMS services while being fiscally responsible and accountable to our stakeholders. I've asked and I'm waiting for it. I understand it's coming.
Yeah.
And I
Tony, I
realize
sent
it.
to the email that Max at the time was our analyst, our data analyst. He did that study. He completed it. I do have it, so does Laura, but out of respect for him, I would have sent it to you.
I get that.
And his father passed away. I told you as soon as he returns to work, I'd be happy to share that.
Yeah, and that's totally fine. I'm fine with that. My issue is that we had a strategic plan that we put out, or that we approved, and we're not giving any updates on it, on an important issue that we have had multiple discussions about. So that was a little disheartening that.
Did you not just read that it said it was coming to us in 2026? We were supposed to get the results for that?
I did not see
I
that.
thought you just read that out of what you just read.
No, well, that was the strategic plan. It said it would happen in 2026, and now it says it's done, but there was no communication with us that it was done. Or what anything,
4 months
it's
into
coming.
2026.
As I explained, Max completed that. We weren't in a position to share it with you without Max.
Yeah. So I want to see that.
But Max is not available.
Yeah, I understand.
We'll have their
It's his
strategic
work.
plan committee provide regular updates to you on their progress on the plan.
Please, that would be appreciated, because again, this body needs to know, eyes fully wide open when we make decisions. And I think there's some eye-opening that needs to happen. So the, let's see, on the strategic plan, actually in the staffing plan we had, that there was going to be 2 firefighters. I did see some communication on that. We approved in the budget to have 2 more firefighters. Is that, where are we at with that? Do we have?
That is handled by the Fire and Police Commission, and we are starting the testing process.
Because we had a list.
Exhausted our existing list.
Yeah.
We had the same problem that we had before, where we don't have enough qualified candidates. So we're going back to retest to try to establish an eligibility list.
Was there a testing date scheduled that didn't happen?
There was a tentative timeline for that date that was rescheduled.
And when was that?
When was the tentative timeline?
Yeah, when was the tentative
timeline date? Was March.
In March.
Yeah,
And when's the new, August is the new
It's now
testing
moved
date.
to August.
All right, so we went to our community to ask for more money to raise the taxes because we had to hire 2 more people, and here we are. The testing won't even happen till August. So I just
Did the
want
weekly
to.
update?
Yes.
We've heard about it many different
Yeah.
times, and we're waiting for a new ALS squad so
Right.
that we can put those 2 people in that squad.
Right. We don't have the
the
equipment.
squad yet for the
Okay,
people
I
to man.
understand. Back to the matter at hand here. So
You went there.
You did.
You just brought it up.
I did, and I accept your answer. Thanks for providing that. All right, the next item that I had on here now was the TCA contract with PSI. I started off with informing you about a letter received because the ambulances weren't being manned. At that time, the contract with PSI was $2.6 million to provide 30 paramedics.
What year was that, Tony?
That was in 2022.
2022.
During the pandemic.
Yeah.
That is
Yeah, 21-22 was the last year of that contract, which was negotiated in 2017, and those rates were determined 4 years, I think 4 or 5 years prior to that. So it was 2.6 million is my point for 30 paramedics. And I get, providing 30 paramedics, and at that time, Alan, you had said multiple times that it would be way too expensive. And at that rate, now that I see this number, I can see that that is a big cost to cover for 30 employees, to cover at 2.6 million. But now, starting on Friday, that contract, in just 5 years, that contract went from 2.6 million for 30 paramedics to 4.9 million 5 years later for 32 paramedics. 32, you said they're paying it. And that's not part of the contract. So we're going to pay 4.9 million for 32 paramedics. You divide that 4.9 by 32 paramedics, that's $154,000 per paramedic. I'm sorry, the answer to the question I've had is how, or the response that I've gotten all these years is it's way too expensive.
It's less than the cost of a firefighter. And that would
You figure
just be
we start-
salary and benefits as opposed to all of the
So-
administrative expense that they have associated with
I
those
understand that,
being
and
their employees.
that's probably about that number. Because right now we start at 79,500. And when you add in insurance, pension,
Pensions.
which by the way, the pension, as I mentioned before, is levied for. Now, it's still our taxpayers paying it, but that pension cost would be added to the levy.
Right, so you would raise our levy, and instead of it just costing us $176,000 a year to
zero.
provide that, or zero when it's paid down,
So
we would have to bear all of that cost and buy new
We'd
ambulances
be
every
paying
3 years.
$4.9 million for it.
So if you want the numbers, I'm sure we can come up with the numbers.
well,
It's
that's
not gonna be in
the
your
whole
paper.
point that I'm bringing up. Everyone should see these numbers. Everybody should know what's going on, but we don't, and that's the problem. That's the whole problem.
So
Been
we
here for
don't
10
know.
years and you've asked for it, and this is the first time you've ever brought up the exact costs of it.
Exactly.
And the cost to our
Because I haven't
citizens
been able to
is
get information.
$176,000.
Tony, who would you like to provide you information on a regular basis about?
I would like this
what-
council to be provided information.
That's not the question I asked. I asked, who would you like to provide that information? Do you want me to attend the meetings and make a report of what happened at the TCA meeting?
I think minutes would be a good starting point.
Well, just like you, they
The other piece
are
that
a
I
board
found
that has
very
minutes and they
frustrating.
approve 'em.
The other piece I found extremely frustrating is I'm doing this research. When you look at the agendas, there's no memos attached to them. There's no contracts attached to them. Another thing that I requested was the contract that we have with the billing service. Oh, which by the way, that was the meeting on April 10th, just a couple weeks ago. You know who the new provider for the billing service is PSI.
There was
Have
an
they done that
RFP.
before? Has PSI done it before?
For us?
Yeah.
Not for TCA, but they.
Not for TCA. They do it for
have-
others.
They do have a branch
Yeah,
of
so
their organization.
I just
that
find
does-
that
Does ambulance billing along with some others. City of St. Charles led that, went through an RFP, had an extensive multi-monthly meeting. They went through it, and they're the ones who vetted and approved that.
and I see that in the agenda, but no information attached to it. And so you can't, again, as decision makers, we should see that kind of information. And we're not.
Except in the case of TCA, you're really not the decision makers. You have.
We're a decision
appointed-
maker to be part of an intergovernment
I
agreement.
let you speak and I.
I wasn't
try
done
not
speaking,
to
as a matter of fact.
Okay. I'm going to have things to respond to.
Seems a little.
That does.
Responding to a comment you just made, I mean.
I can share
So I would like to see that breakdown of the cost, because that's
From who?
not the cost that I've been told.
Breakdown of which cost?
The
But
cost
I'd
of
be happy
hiring a
to provide you
firefighter.
what you're
What did
looking
we
for.
put in the budget?
Which breakdown are you looking for?
How much we pay
The
a
cost of
firefighter.
hiring someone.
Full time?
Yeah.
$113,119.33.
We are paying $154,000.
This is for the starting,
Yeah,
initial starting.
yeah.
And not all of those people are starting
And it doesn't include all of the
Nope,
supervisory
but-
costs, it
yeah.
doesn't include all of the HR costs, it doesn't include all of the
So-
administrative costs of paying them and all of the additional
That
costs.
contract for $4.9 million solely pays for PSI to provide 32 paramedics to TCA.
Correct.
A pretty good deal at
All benefits,
154,000.
And it's up 88% from what it was 5 years ago.
I'd love a chance to explain that. And I think we have people here who have some expertise in the area too, who could maybe back me up, is that what happened through the pandemic and has occurred throughout the healthcare industry. It's why you see the horrible wait times in emergency rooms, is because there was a mass exodus from the healthcare industry. You should also realize that in terms of the turnover, many of the people who are paramedics are looking for full-time firefighter jobs. And so that we see that with our paid on-call employees. Many of them are also looking for full-time. So I would say we've probably had as much turnover on our paid on-call, and we have a tremendous investment in each one of those people for the training that we give them. But overall, we feel that there's a benefit to our paid on-call program because they end up on our list. And if we have the opportunity to hire them, they know us. And it would be the same for PSI. If one of those people ended up on our list, they would come into our department already knowing our procedures. But we fully expect there to be high turnover. We realize that in 2022, 2023, we're experiencing such dire personnel turnover on the PSI side that we had several meetings with them that we said, you have got to solve this problem. And they solved the problem by raising their starting pay, paying people bonuses.
And time off. They know
And
they
time
have
off.
one.
They've been raising what we pay immensely, 88% increase in 4
But
or
it's
5
the
years.
going rate for
So
EMTs
I'm glad you brought that up.
It's an
that-
industry thing, it's not a PSI thing.
So we should be considering if when the next pandemic rolls around, how can we best protect ourselves from that? If we employed people, if we made Batavia Fire Department a destination district for paramedics that were our employees, we wouldn't have the problems that we did with a company that's just providing paramedics, and it's a revolving door because, like you said, many of the paid on call, many of the paramedics want to get onto a fire department. That's the goal, and that's the career path to do. If we had them on staff, we would not see that turnover because that's their destination. And I think that needs to be taken into consideration. We do the same happens in school districts. And I can tell you the districts that are more successful are districts that are destination districts where people come, they're valued, and they'll stay there. Batavia is a destination district.
I don't want to get into a contest of how we're going to compare a school district to a fire department.
Can I just
Two
finish?
totally different things.
So my objective, again, I'll just close with this and then open the floor up, is, and I've seen some eyes open here that this council needs to be fully aware. And I ask that we get the information that we request, the information that's relevant, that comes up when a big contract like that is put out, we should be informed about that. And so we can make the best decision because, again, we are the decision maker for how the ambulance service happens. I think Tri-City Ambulance is a great system. Outsourcing the paramedics creates a revolving door, and I don't think that provides the best service we can for our community, and that's the problem I have. That is the only problem I have is the quality of care that our patients or that our constituents get by this arrangement.
Okay.
And I don't think it's way out of control. I don't think the costs, it hasn't been proven to me that the costs are so exorbitant that we couldn't provide the top quality of service that our constituents deserve. So, I'm done.
Okay. I just want one response. I'd like to see the complaints from the chief and from Geneva and St. Charles to compare to see if there's a quality problem.
Yeah.
I have not seen that.
No, we
I've been here for 24 years, and I will tell you, I could count on two hands the times I've heard complaints about the paramedic service in this town.
Okay, what I would say to that is I've heard from a number of firefighters, and that's where you're going to hear it from. I would say, let's survey them. Let's survey
think you
them.
hear from
They're the ones that are in the trenches.
I'm concerned about the
They're the ones that
patients.
are in
You're the
the
one that's
trenches.
saying
You
it's
just said the
good quality of
constituents.
service.
Wouldn't you think the patients, if the patients have a complaint, they're going to complain? You said you're worried about the
It's
constituents.
not only patients complaining.
But you just said this whole worry is about the constituents and quality of care. If there's problems with quality of care, believe me, people are sue happy. I defend doctors and hospitals. They would be suing all the time if they thought they were not getting good quality care from the paramedics. I'm not, and that is not in any
I
way.
didn't say it was only complaints from patients.
No, come on. The point is, you said that you want quality of care for the constituents, and what Alderman Wolf just said is, let's see where these complaints are, because I mean,
Yeah.
I'm telling you,
That's again.
and I'm telling you, if you're saying paramedics are complaining, I mean, not paramedics, you're saying firefighters are complaining, I'm just not buying that
We don't
because
need
the
to argue
patients
about
are
it. We don't have
complaining.
the data. So let's get the data and let's go
get
from
data.
there.
Okay, we're going to stop
Would
real
it be
quick.
fair just to allow us as staff to respond to some of the things
Yes.
that Tony said that I just kind of want to
Actually,
either get
I'm-
answers to?
I
or-
wanted to open it up to the floor here first because this was a discussion of the council.
But I want them to discuss things that are, I don't want them to think that they're working 36
It's a council
hours.
discussion.
That's not fair.
But it's a council discussion, and as the committee chair of city services, I asked for this discussion, and I would like the council to be able to chime in.
I will start discussion. Robin's had her hand up for a long time. And she'll start.
Yeah, so I have a couple questions, some of which just got answered, so.
Can you pull the mic down a little bit?
Yeah, sorry about that. Okay, so as some of you know, I am an owner of a private ambulance company, so I'm pretty familiar with this space. I will say that during the pandemic, paramedics were literally impossible to find and hire. I can attest to this. It was impossible. There was something like 80% of emergency medical technicians in the state of Illinois between 20 and 23 did not renew their licenses. Like, there was just nobody. I mean, so I could understand why that would be a real issue when you think of the time that it would take from an HR standpoint and an administrative standpoint just to even find these people to get in. I mean, that would be, and as somebody who was doing that, it was really tough and it was very time consuming. Also, the salary increases, I'm paying my EMTs about 88% more than I was paying them in 2020. That is, I mean, the competition has driven the salaries up incredibly in the last 6 years. So I can see some validity into some of the things that, some of these numbers that we're looking at. My other question was, so then we wanted to see the differential between what would it cost to contract this out and then what would it be to do it ourselves. That would be some interesting numbers to look at. The second question I think you guys brought up was, do we have actual instances of complaints of care issues from the PSI paramedics? And I think it might get kind of tricky asking firefighters to do a survey to give a report on people that they're working that closely with. That could be kind of tricky. One other point, the Medicare and Medicaid billing. So Andres, when it was Andres, now it's PSI. So they just send the bills to the patients. They do not bill insurance for the city, or for the transports from TSA, correct?
No, they do bill insurance.
They do bill insurance?
Yes,
Okay,
correct.
okay. So
It's not until after insurance, Medicare, and Medicaid have cleared.
then they'll bill
Then they
the
bill-
balance,
then-
but you
correct.
can't bill the balance on Medicare and Medicaid. And that's
No.
part of the reason for the losses, is that it's against the law to bill that balance on Medicare.
As you know,
and
there's a
Medicaid
cap,
patients.
and that's what,
Yeah.
if it's a Medicare or especially Medicaid
Especially Medicaid,
patient,
don't-
you have to accept that
Yeah.
cap and the rest. That's why the write-offs
Yeah.
are so big.
The
So
only
that's
thing-
where the write-offs are,
Huge, yeah,
Yeah,
they're massive.
that's where they are
Right, so
come
the same
from.
thing, yeah.
Correct.
So, yeah, I think the only thing you can bill for is like copays or the deductible.
so in Medicare and
January.
Medicaid
Yeah.
costs, yeah, that's where the write-offs come because you can't bill past
Yeah.
that aspect of it.
Just really quick along that line, the same thing with insurance, because some people have health insurance. Do they also send that to the insurance companies before they get billed?
If they have supplemental policies and they're on Medicare, yes. Medicaid doesn't have supplemental policies. It's indigent.
To have somebody that knows coding to be able to do that.
Right, and that's why we do a third-party medical billing services that knows all those regulations.
Then the last question I had was, now you mentioned that PSI has changed their sick and vacation policy. Is it not, I don't know if this applies to contracted employees, but as of January 1st this year, is it not required that all employees, part-time, full-time, everybody has to get PTO?
Yes, and that's
Yeah.
why they've
Okay.
changed.
Yeah.
Correct.
So they have to get, so everybody who works a full-time job will get, I forget what the calculation is. I should know this off the top of my head.
It's based on hours worked.
It's you get, yeah, for every 40 hours you work, you get an hour off, something like that. So they get at least a week of vacation.
Wendy's
for
nodding.
Full-time employees. Yeah, I know, I'm like, Wendy, I know. I have ADP do my payroll, so I know there's a calculation, but, okay, so that is also not a concern anymore. Okay. That was, yeah. And then I guess my question is, Tony, then are you just wanting us to look at the cost differential, or you have a strong opinion that we should be having have our paramedics for the fire department on staff?
So
Okay.
I would prefer that they be our employees. But if it turns out, if we are fully aware of the whole situation, everyone is informed, then we make a decision from that, and this council decides, hey, this is the best way, let's keep doing it, so be it. My point is, we don't know, and we need to know. That's the whole point. And then, what's your other question you brought up? If I would, your comment before at that time coming out of the paramedic or pandemic, I agree. It was horrendous. That's why we would have been better protected had we had our own employees. I think.
Perhaps I
Where
think
you
that
weren't
people were
having,
leaving
where you
healthcare
weren't
out
having
right
a
and left.
turnover.
And all in overtime.
Is Wendy able to respond to that? Is Wendy able to
Employees that have
respond?
a pension and are valued by employers stay at those employers. That's the reality.
I would agree with that statement, but I think the difficulty in recruiting didn't necessarily come from that. It came from the pandemic. During the pandemic, paramedic schools shut down.
Yeah.
And so we have this gap of catching up, that if we're requiring our firefighters to be paramedics, they're behind in trying. So yes, you talked about people who decided not to renew their license. So we had that issue, but then also we had a whole, couple year vacuum where there were no or very limited paramedics going through school.
I get that. Yeah.
And getting into a school was next to impossible. So we have this gap that we're still catching up on.
Yeah.
Still to this day, I mean, today you see when you recruit, there's, recruit and you get 20 applicants where 10 years ago you'd get 200. It's
Exactly.
very,
Yeah.
very different.
And I totally agree with that. My point is, had we not had a contract service for, before the pandemic, we would have made it through the pandemic in much better shape than having a contract service. And so,
I'm not sure financially that's true.
well, right now I'm seeing the cost that we're paying is not significantly more. Or actually, I believe it to be more. The chief just said it was more to hire someone.
No, we're
But I
paying
think-
$176,000 for that. That wouldn't even cover the cost of two
So we pay
employees, and we
pay
need 6 on 3 shifts.
$96,000 more for benefits and pension?
I
If
think
the starting salary is
there are many-
$79,000, you mean
there-
to tell me?
We're talking about two different things.
Yeah,
here.
we're talking about the annual that the city of Batavia pays for Tri-City Ambulance this year is $176,000.
I'm talking about the cost of one paramedic.
113.
Okay.
113, we're paying 154.
We're paying
Currently.
$176,000.
What I was trying to explain to you is that
No. We're providing a service.
I never even get to respond. I'll send it in writing tomorrow.
Jim's had his hand up for a bit.
Okay, well, Jim's gonna have to wait.
Okay, sorry. I'm sorry.
Let me run the
It's been a
meeting.
long waiting.
Tim's next.
Oh, no, I was just going to say, I think, some of what Tony brings up are some great points. I think, you can replace transparency with just communications, right? And I think we have a council here now that is very eager and hungry for some of that data and communication. So I think you guys are picking up what we're putting down there, and that's nothing new here with this council. But I think what we're dealing with here is a little bit of, the public versus private conversation. And, there are two ways to look at things, right? I do tend to think we have a business owner over here of a similar establishment. Again, I need to see the data, but I'm willing to bet some pretty penny that it is going to be extremely more expensive, all in TCO, on hiring 30 paramedics here in Batavia and keeping them here. And then what if we do see the same turnover? Now we have our chief and others, and maybe a board that's, has to go hunt these people down. And then guess what we're doing? Raising salaries. We're coming up with the ideas rather than holding a third party accountable to a contract that we signed, which portions of that, I couldn't agree with you more. I'm all about holding people to their contracts. And I think I was the first one who came in here and said, wait a minute, these guys have had a contract for 40 years. I've never heard of such a thing on anything. So I want to see data too. I'd love to see what was shopped, who came back at what price, all that good stuff. I'm sure they came in lower because they know our operations, they know their operation, all that. I just find it hard that there's not somebody more hungry out there with, hasn't thrown a better deal in front of us in 40 years. So, all that said is I think there's a lot of positives to the TCA and everything that goes along with that. I think we're at this point where we need a little bit of an assessment, a little bit of that, quick data dump of, okay, we pay $176,000 for these 30 folks, which again, I know there's some numbers discrepancy there or whatever, but I think it's $176,000 for the annual payment to TCA, right?
Period.
So
all
that's
in.
divided, that's 176 divided by 30, Tony.
No, so maybe I stated this wrong. Let me restate what I was saying. The cost of 32 paramedics that serve all the Tri-City, we have 12.
Right.
We have
Okay,
12.
right.
So 12 paramedics.
So 12 divided by 176.
But no. 176 is just a nominal fee that's paid to balance the books with Tri-City. That's each member. The real money is coming from the fees. There's the revenue was 17 million, 10 million is written off. There's $7 million out there. From that, we pay for the cost of 32 paramedics.
Plus.
No.
it
That
isn't.
contract, I've read the contract.
You're paying for the service. That service includes everything
Yeah.
that company has to do. They
not
have
just
to have
salary and
profit.
benefits.
They have to have their employees.
Yeah.
They have to hire and fire
are you
and
saying?
manage
If we
everybody.
did that, we wouldn't have those costs.
So we'd have to add more people
Yeah,
to HR
guys.
to be able to do that.
So-
More people to the department to manage that.
We would provide a service
I-
that our community deserves.
I go through this all the
What
time.
aren't they getting, Tony?
I-
what are they not getting now that they
so
deserve?
I'm
so
part of a
the point-
manufacturer rep.
so
Hang
the-
on, I
the
was
point-
talking.
I wasn't finished here.
I wasn't finished.
That's it. Discussion
Quiet.
is over. We're done.
Decorum, please.
Clear your heads, but I was making
Who
a-
was talking?
I have very...
Tony, who was talking?
Okay.
I was still talking.
I
You've been
was.
talking for
I
45
said your name.
minutes.
Hey,
I was
both
talking.
of you stop, or I'll clear the room and we'll be done with the meeting.
Well, I don't need.
I don't.
I know where the
I know.
decorum lied. I'm the one who got told by this guy when I needed to shut up last time. So all I'm trying to say is that there needs to be more, like I would say, I like to say communication. I think you guys are transparent with us. You try, but I think we're hungry for more or hungry for different or what that looks like. What are they, like, what are the fees? And I think it's maybe a chief thing. What is the profit? Not that I'm not saying PSI doesn't need to make profit. I want the private sector making profit, no question. They'll provide better service that way, usually. The question is what is it? Can we capture that? Like, let's just run the number. Let's do the exercise. I'm pretty confident, even after capturing the revenues from that, we're still in a spot where we need to hire too many more people from an administration perspective and everything else that overlays with that, not even to mention the pension on the taxpayer. that's the biggest one that hits me. These are forever costs, right? So that right then and there is like no pension. You know, I have a rep firm. We're hired by companies for this exact reason, right? We're a simple line item on their spreadsheet. There's no pension, there's no health insurance, there's no car, there's no anything. It's a straight commission payment. So I see it as a very similar concept. I just think we need to be settled back into it and just, yep, this is the right call type of thing. And, you know.
Happy to do that.
Jim is next, and then Leah.
Yeah, I'm sorry I'm not there. Maybe I'm happy I'm not there. I'm not sure. Can you folks hear me?
Yeah.
This is very normal to like my business. Okay, so the term we use is dual badged employees. Like there's a term for it, right? Employees who look like they work for a company, but they actually work for a supplier. Very normal stuff. The term is dual badged. Okay, under a flexible staffing model, which is always cheaper every time for the customer, right? I mean, the reason why you want that flexible staffing model is number one, it gives the employee flexibility so they can be so they can be mobile. Not everyone wants to work in a single place for multi-year. Sometimes they want to do their 3 months and leave or what have you. Secondly, the customer gets predictable costing for the life of the contract, right? So it's easier to budget for this stuff. Because you're just paying for either an hourly, weekly, or monthly basis, or whatever the terms of the contract are. Okay, so that's the labor model. We use that for specialized technical help. It's been normal for 30, 40 years, right? It's nothing new. But again, the term is dual badge. They look like they work for the company. They actually don't. They work for a supplier. Okay, and then the third part of that is usually underneath these contracts, and I haven't seen the contracts, so I don't know if it's there. There's an option where they can say, hey, if I have hired this contracted employee from the supplier for more than X number of months or years, I get the option to flip them to full time. Right, so that may be in the contract as well. I agree there needs to be more information here because it sounds like we just don't have enough of it yet. But the staffing model we're talking about, very normal. And the other part of this that's on the other side, I'm glad we're talking about this because you're going to laugh. I live next to the Homestead. It is ridiculous the number of times that ambulance is going in that building. I mean, you're talking 3 to 4 times a day, easy. I hear the sirens every time it goes in. Okay. However, we're billing them, they should be paying more. Whether it's they pay a flat retainer and then every call under X number, they pay more. I don't know what the model is. I agree the cost should all be deferred to every resident there, but they should pay. Now, I feel like we have enough history with these establishments where we can say, hey, you're going to pay us X number of dollars up front for a monthly service, and then when you go, then an additional amount per visit after that. Just a thought. Okay. Thank you for your time. I'm gonna be quiet.
Yeah. Next.
So on my now 5 years on council, this conversation has come up a few times. And from my observation, I just have a couple of thoughts. Number one, it has always been a very heated topic, and I can't figure out why, because there's nothing here in reality that should be heated. We're asking just for, well, by we, I think by what I'm representing Tony here, we're asking just for numbers and transparency, and I do feel like every time this comes up, it's kind of, numbers are thrown out in this room, but nothing has actually come through in an actual agenda or a memo. And that's kind of why it was included in the strategic action plan, to have a study done, to an actual study done, to compare the TCA agreement with PSI or any other contractor with bringing it in-house. I think Tony had asked that years ago, and that's why it ended up in the strategic action plan. We just want to see that comparison, because if we can see it really actually is saving us millions of dollars a year, then yay, we can clap along and be like, okay, this is good. But so far, we have not seen that data, and that is what I think was Tony's agenda tonight. Because at the end of the day, PSI is a for-profit company. And so some of our money is actually going to a for-profit company. As a city government who taxes our residents, that's something we need to have information on. And I know there are other communities, both in Illinois and probably other states, who have brought their ambulance service in-house. How's that going for them? How is it financially for their cities? Are they glad they did that? Do they wish they had stayed with a for-profit contractor? Lots of people, there's lots of communities on both sides, some who have had contractors who moved in-house. Have we talked to them? Have we said, is this better for your fire department? Is this better for your morale? Do you see longer term people staying with you? Because for any business or city, there's short-term costs and there's long-term costs, and there's short-term benefits and long-term benefits. This has a lot of short-term benefits doing this TCA agreement. But I think what we're trying to ask are, what are the long-term benefits for the city? And I don't understand why asking those questions gets a lot of defense and upset reactions. They're just basic questions. And I think once we get numbers, we could decide that even something like a TCA is still good for our communities. And maybe we can find a way for all three of the TCA communities to bring it in-house and not then use a for-profit company. I think thank you, Mayor. You started this 40 plus years ago, but I think sometimes after 40 years, it's okay to revisit agreements or revisit how we're doing things and say, this worked great back then. Do we need to reevaluate? And maybe the reevaluation is we still work with our other two cities. We all share ambulances. We all share paramedics, but we're not doing it for a for-profit company. So I think what I'm asking and supporting here is just more data. We just want to see the numbers. We, as a council, want to make that decision just like we do with any other contract, with the garbage contracts we do, with the energy contracts we do. It's that this is our job. And when we feel like we can't do our job, that's when we get defensive. So we're just asking to do our job well.
Preston, you're next.
Building on some, I feel like there's been some miscommunication in this discussion over some of the numbers being thrown around, which is pretty easy to do. I think the number Tony was putting forward regarding in per employee cost was the roughly $4.5 to $5 million that is paid to PSI divided by the number of employees, 32, which would you assume we cover not only the cost of those employees, but also all overhead, administrative benefits, stuff like that. That comes out to about $156,000 per employee if you factor in those aspects. I think that was being conflated with the amount of money that Batavia pays into TCA as a direct thing. I don't think those are intended to be conflated. I think that was at least part of that miscommunication. So I wanted to put that forward. Whether or not we could do that cheaper or not, I think is obviously a very open question. And I think is that what Max's study goes into a bit? I think that's what I think we're all eager to see here. And obviously the timing is very unfortunate for all of that. So I'll be eager to see that when it comes, but there are difficult circumstances with that as well. I think that will answer a lot of these questions. So I'm looking forward to see that. But those are numbers I think we need to keep in mind here. Secondly, I had a question about the contract with PSI. It was mentioned that a lot of their personnel later sort of graduate into fire personnel / paramedic roles.
I don't know. They
not necessarily
full-term firefighter.
Yeah. That's kind of the career path, I suppose. We have a non-compete agreement with PSI in this contract, at least for 90 days, I think it said, where we can't directly hire through that method. Do they usually go to other cities' fire departments? And conversely, that agreement, is that just for employees serving us through PSI, or is that the broader PSI ecosystem, which also includes other municipalities? And has that led to sort of friction in that career path?
It's specific to the Tri-Cities in our language, but the 90 days is immaterial in that we have to go through a state testing process for a hiring list. So we cannot hire them directly for a municipal fire department.
They're on our list.
Unless they're on our list.
Yeah.
So,
I see.
Which
yeah.
that's
So
possible.
in our particular case, it's not really.
Okay.
It's not a factor.
I guess.
But we do have a lot of personnel who work on the ambulance, and I can name a number who have started their career on the ambulance and have either come to work for us full-time as full-time firefighter paramedics or go on to the neighboring communities, including myself.
And I think, I didn't know that.
Yeah, I was, as the mayor knows, I was one of the original 1982 paramedics.
Oh, wow.
And I am still a paramedic,
Right.
45 years later, but yeah.
You don't really lose it, I suppose.
Oh, you do. Kind of like a language. You got to use it or you lose
That's
it.
fair. That sounds
Okay.
having fun. I think more to Tony's point, though, having that consistency of staffing, having that consistency of who you work with does go a long way. And it's interesting to hear that at least is somewhat maintained under the system. So it's, an aspect of it to consider.
Yeah, thank you, Alderman Pieper, for sharing that. I was going to say the same thing. I think we were conflating some numbers, right? The 175-ish K that we're paying in isn't the same as the salary rate, because of course those are paid through by Medicare, Medicaid insurance, and a whole lot of that money goes in. So I wanted to make that point as well. How often are our employees, the firefighters, staffing onto the ambulance? We had talked about how
They do not cross staff.
not ever.
Not cross staff.
Zero
There's
ever.
zero cross staffing. It's a contractual.
You told us before that you had jumped on the ambulance, and they
I
said,
did.
"Oh, when the chief jumps on the ambulance, everyone
I
knows
can jump on
something."
the engines.
Bargaining unit.
I can jump on the ambulances because I'm the chief
so no one from
executive
the
officer.
bargaining unit is allowed to jump.
No
on
one
it.
else is allowed other than
Okay.
myself.
Okay.
And that's just because I'm the
Well, you
chief
fill
and
in, right,
understand.
yeah.
Right.
Okay.
I'm the contractor.
Okay. And so when there is a vacant, when they can't staff up, then what do we do?
They're mandatory, just like the firefighters.
Okay. So
Yeah.
they make them come in.
They make
right?
them come in there or stay. They don't get to go home. The only time I've jumped on an ambulance is when there's been an injury
Yeah.
or an unfortunate situation.
And so PSI has provided 100% staffing for the entirety of their contract? I think
For the
I'm not
not
fully
the
understanding
entirety
here,
of the
'cause I was told
contract.
your
We
story
struggled
were-
across COVID.
Okay.
During the
Across
COVID times,
In
there
recent
there
years,
was a
we've been
struggle. Not
at
since
100%.
COVID.
Okay,
And,
great, thank you.
just in clarification, I know we keep saying 32 employees, and that's what the contract calls for. PSI added the additional one, so we have 33, and that's what he does. He jumps that ambulance rather than me, the chief, jumping that ambulance. But I had a case where I treated the paramedic that got injured on that call. Yeah. And she was amazed. You got that IV first shot. I said, pretty scary, huh? Never know.
Right. And I think that speaks volumes to why we got cross-trained. It seems like it's a good policy for our guys to be paramedics as well as firefighters. Makes a lot of sense to me.
Absolutely.
Okay. The last quick things I wanted to say is, first off, I don't think I didn't hear Tony to say anything about ending Tri-City ambulance. In fact, I heard expressly the opposite, just that in-house maybe have a cost benefit. I don't know. There may be a moral component there. We can talk about pensions and treating people well, but I didn't think that meant only Batavia. Was that kind of correct, that you weren't really thinking of Tri-City itself being in question, more the contract?
Yeah, no, I
Okay.
firmly support Tri-City Ambulance. I think it's great. It's the outsourcing.
Okay.
I think we're
Thank you.
overpaying.
Yeah, I just wanted to clarify because I lost that.
Okay, Kevin, I just wanted to add, I'm sorry, that we do value them.
Oh, yeah.
And part of that, value is having them be a part of our team and wear our uniform and everything. So
Yeah, and
there's not a
Right.
situation where they're felt to be any less or different. They sleep with us, they eat with us, they work with us, and they dress with us.
Yeah. Yeah, I
So
understand
they're a
that,
valued part of our
I don't
team.
have any doubts that, all the firefighters I've met, which are quite a few, a lot of them go to the school next door, wonderful people. I have no doubt that they're treating them well, and I don't doubt that our
don't think it
staff is
matters
as
where their
well.
paycheck
I think
specifically comes from.
when I say that, I just mean sort of from the philosophical standpoint of government. Sometimes our role is not the same as a private company, and so providing a pension is something that governments choose to do. I don't want to get into that right now.
We have a lot of, I
don't
do a
wanna
lot
go-
of pride in my
yeah,
department and
yeah, I
all those.
apologize if that
Whether they're
came
paid
off
on
as-
call, the
as
ESDA
any sort of-
volunteers,
any sort of,
or any
thing.
part of my staff.
An unintentional
Papa
slip of
Bear
the words.
gets a little defensive. Sorry about
Unintentional
that.
slip of the word
My
there.
apologies.
It's just as I think on the larger scheme and the 77 turnover folks, I think there's a value there, but that's not what I wanted really to dive into here. Okay, so just the last thing I'll say is that, as a reminder, I'm a divorce mediator. Today I had a pretty rough case where folks got positional very quickly. Positional is the language used, and I just saw it right now. Right now it's like, wow, the first time on council, we've had some rough nights. That was an incredibly positional thing where I think we were talking past each other and not listening to the interests. There's a lot of interests that I'm not catching from either Tony or from staff. As soon as Tony was bringing something up, it felt positional, and I was feeling as if the other people were getting defensive immediately without hearing or listening or attempting to understand. And then the response back the other side, I heard similar from Tony. I apologize. You're great and very passionate, but I heard that same thing there. It just left me more confused. Because I really thought that folks were just trying to defend themselves and not trying to dive into the data. I don't think we're going to get any further on that tonight. And this is a hefty topic. So just to address the conflict in the room, like I saw that this morning and I saw it worse here today for the first time I've ever been on council. So that positional nature there, I'd like to dive through it, and maybe offline is the better place to do some of that, to try to send some emails and get to the bottom of this. So. But thanks for the discussion. It's a good one.
So I hear that, there's this support for TCA, but Chief, maybe you can tell me, maybe somebody else can tell me, maybe Alderman Wolf can tell me. If we go in-house, we're basically going to have to withdraw from TCA and buy our own ambulances, right?
I would assume that would be the only way to do that.
Yeah, the contract calls for a 1-year notice to all associate partners, so you'd have to give 1-year notice. And then the distribution of assets would have to be determined by the board and the entities, so.
So we'd have to give our 1-year notice of withdrawal, basically.
Correct.
And then when we go in-house, then we'd have to figure out where we're getting our ambulances, and we would just be disassociating with TCA. It would be dual city ambulance, I guess, instead of tri-city.
It could be. That would have to be a decision made by the board at the time, but under the existing IGA, it requires a 1-year notice. And then the assets, the disbursement of assets would be an item of discussion, no different than a divorce, as Kevin indicated earlier.
And that's basically what it'd be. It'd be a divorce from TCA is what we'd be doing.
Right. You'd basically be entering it, yeah.
Ask a clarifying question real quick. Is there anything stopping TCA from hiring the ambulance drivers, like as government employees? It is a government entity.
No, that again,
So they could choose to do that.
Right.
We wouldn't. But
We wouldn't. That's what we want with PSI.
An example of that is TRICOM. TRICOM is also an intergovernmental agreement. IGA hired its own employees as dispatchers. So their real goals are, well, TCA was based on TRICOM, the TRICOM model, and it stayed with contracted employees and Tri-City, but they have the same board meetings, same minutes, same IGA, same budgets, same cost things. Their revenue is based on fees to the participating agencies, and their model is not much different than this, other than TCA has chosen to use contracted employees and TRICOM has chosen to use in-house employees.
I apologize for a question. Do you have the option to hire somebody who's been on staff for a certain amount of time? It's usually normal with these types of contracts.
I don't think so. Jim, we have to hire off of the list. We have to run a test under state statute and provide an eligibility list by the Police and Fire Commission. So we can't just, if they're on the list, we hire them just like other municipalities, but we can't just reach out and hire them directly from PSI.
Okay, so to play that back, so if we have somebody, they're dual badged with us for like 3 years, we love them, they're awesome. We sit there, hey, we have an opening, let's flip this person to full-time at Batavia. That's not an option under this contract, or is a way around that?
That is not an option. There is not a way around it. We do, however, in our paid on call, part-time personnel provide preference points for that aspects. And there are additional points for trainings and aspects that if they've been in the fire service or a paramedic for a number of years, it will help them in the testing. But there is no points for being a PSI employee on the Batavia contract.
Got it. Thank you.
Thank you. Dustin?
I just wanted to ask a point of clarification. Is what is being perhaps not necessarily proposed, but raised as an idea, the city hiring paramedics or the Tri-City ambulance hiring paramedics? Because I think that's being batted around, and I don't know if there's been, Tony, what were you thinking in that case? And also, I'll ask the study that Max did, which one is that assuming?
So I envisioned that we would the city would hire their own paramedics.
Correctly.
Geneva would hire their own paramedics. St. Charles would hire their own paramedics. But there would still be the cooperation of the ambulances. That's the possibility. So it could be discussions with others. Because I do understand we are in intergovernmental agreement. We've been it for 41 years. Doesn't mean we should keep doing it just because we've been doing it.
Sure.
I think.
I might suggest that if it were under TCA, that would help consolidate some of the administrative costs that we're talking about. But I don't know. It's good to get that clarification. And this report that Max did, that also is assuming Batavia itself hiring directly?
The report that we worked on, that Max worked on, was in-housing, meaning hiring our own firefighter paramedics, not just paramedics.
I see. So they would have both roles.
They would have both roles. So they would be additional firefighter paramedics to the Batavia Fire Department with the purpose of staffing the ambulance in-house.
Thank you.
Which would require us to have 3 city-owned ambulances.
Okay. That's fair. Thank you.
Sure.
Leah?
I was just going to say a benefit I see to that, having our own firefighter paramedics is incredible flexibility with people then within our own community being able to be on the ambulance. So when it comes to time off or people being out sick, now we have an entire staff of firefighter paramedics who can man an ambulance. So that would be in the benefit category, like check for coming in-house, but because right now they can't, as you said, our firefighter paramedics cannot get on an ambulance.
At present, we have 24 full-time firefighters. Not all of them are paramedics. So not all our full-time firefighters are currently paramedics. The more senior ones were not required to be paramedics. And Tri-City Ambulance, again, has 33. So they work across the 3 towns.
Right. What I was just saying, though, is right now we have full-time firefighter paramedics who are on the City of Batavia payroll who cannot be on the ambulance, so they can't fill our
correct, and the ambulance personnel cannot fill the fire.
Right.
Same thing.
So we don't have the flexibility. That's all.
No, that because we don't have the paramedics are no longer required to be firefighters either, so they can't cross to the fire.
Explain that a little bit. Why we don't require the paramedics to be firefighters?
Sure, I sent it and I explained it to Tony. So our call volume has now exceeded, as the mayor's pointed out, over 5,000 calls. Our call volume for EMS is, like I said to Tony, approximately 70% of our calls, which equate to about 3,644 calls or so a year in ambulance calls, which equates, divided by 2, to a little over 1,800 calls. Because of that call volume, the extensiveness of that call, of that volume, which is a minimum of about 5 calls a day, 365 calls a day, under ISO, which is what we follow, the ISO standard, those units can no longer be counted as supplemental and or fire units. So when we went for our last ISO grading, they no longer would count as fire units. Prior to that, we were sending them to fires and counting those personnel as firefighters. We're no longer eligible for that because of the extent of our call volume. Because under ISO regulations, they can't depend on that unit being available at the time of a call or a fire. So they are no longer required to be that. The other problem with doing that is they're due to the hours that they are running calls, they can't maintain the training requirement under the NFPA and the OSFM to meet to continue the education for the firefighter standard because of the amount of hours they have to do for the paramedic and EMS standard plus the call volume. Sure. Maybe.
Yeah, I just wanted to say thank you to Tony for continuing to bring this topic up for us to revisit. I think it's really important. I learned a ton and took a lot more notes this time than I did last time around too. And also wanted to second what Lancey and Lehman followed up with, that there is just a craving for some more communication and some more information. And in my experience, and I've heard this said before, where there is a communication vacuum, negativity tends to fill that void just across the human experience. And so I feel like there's maybe a little bit of that going on here. So I'm very hopeful that all of the contracts, the intergovernmental agreements, the budgets, the studies can all be sent to all of us here soon. And I would definitely like to put a plug in that if it's going to be in advance of a conversation, I can't read it Tuesday afternoon before a Tuesday night meeting. Like, I need more time to review something, or I'll just ask to table the discussion because I won't feel productive. And a note too about the lack of minutes, is that something we can ask of the St. Charles, administration, that minutes are posted, agendas are posted with attachments in the future to kind of aid in this process for all of us. And then my third point is I have also heard complaints about certain teams of our paramedics from firefighters. I don't know if a survey is going to be effective. I would venture to believe it would. And certainly, Chris, I know that you have a valid point that if there was a problem, major problem, you would hear about it, or folks would hear about it. But I can say, and I've had limited interactions, thankfully, with our EMS teams. I can't judge them, from case to case. I've seen them once, every couple of years in very different scenarios. I don't have any frame of reference. Our firefighters that are going out on multiple lift assists, on multiple cardiac issues, on multiple fainting issues, they can see patterns, they can recognize differences in quality more than I can. And I'm curious if there is a current process for when they do feel a lack of competence, is there a process for reporting that up the chain, and how is that handled?
Absolutely. As with any complaints or concerns with the public, with any of the employees and things, they can either, make a complaint to the officers and come up the chain of command. They're always welcome to come to me directly, or they can make a complaint through the Southern Fox Valley EMS system, through the hospital, through IDPH, through Region 9. Not only can they make the complaints, they can all,
Jeremy helped me and gave me handouts so you guys can read these. Great. Okay. Okay, I am bringing this a little bit backwards. We do have the money budgeted for this, so we had to act kind of quickly on this. We've been working with Samsara for our street division, and other divisions were interested in putting the GPS unit on the vehicles. So they had provided us a contract and to extend it to the other divisions within Public Works, as well as a couple vehicles for community and economic development. And they gave us a price break that we kind of had to act on quickly. And with it being budgeted, we moved forward. It was a 25% discount to do it.
immediately, so I apologize for not bringing it before you guys before that, but this kind of highlights and points out all the reasons why we are enjoying this software in our vehicles. With our streets division, we were able to have it over this last year and able to track them when they were out doing snow. It tracks their routes. It has the camera so we can see, and sometimes, if the mailbox goes, we can go back on that address and look at that, as well as people that don't happen to get their leaves out in time and call and say, well, they missed my leaves. And we can go back and look at the camera and be like, well, there were no leaves there when our truck came by. So, it's accountability. And then in emergency situations, we can deploy vehicles or call vehicles that are closest to them. We're learning things every time I go into there. There's something additional in the dashboard, and we'll be able to do reports. It immediately it's hooked up to the codes in the trucks and vehicles. So when a code gets pulled, it goes immediately to our mechanic. So he knows that there's an issue with the vehicle, can see the priority of how severe that is. I was talking with the other day, he's like, this one just keeps on running, and I get like 40 emails, so it's just delete them and he'll figure out what that is. But we can kind of work on the system for maintenance. It does idle times, seatbelt speed, the engine time, all of these things. And we just think that it's a real value tool, and that's why we've decided to get it across the rest of the vehicles. And we hope to get it implemented within the next 2+ months. We have to do the installations through all the vehicles. It'll be, I think, an additional 40-some vehicles. There's 4 in CED, and then there's, okay, there we go, 46 total, thanks. So 42 additional ones in Public Works. And one of the things I want to test out is just being able to use the vocal part in there. If we need a call out and we don't want people getting on their phones, we can just say something and send that out. Or, Jeremy and I were discussing this earlier and joking, like, boss lady says slow down if the speed is over a certain amount. But great things with, again, accountability, and we've been able to pull up the video when we need it. And it also will be able to be integrated. We're working with ViewWorks, our consultant, and it will be able to load potentially into that asset management as well as other fleet software. So more and more things are integrating with each other. And everybody is excited to get it in their vehicles and kind of see where this goes. And if you watch the Super Bowl, we had a Paycom commercial, and then I don't remember if it was before or after, it was Samsara. So I'm like, oh, look at that. They're like big time. So they're out there. Once we get this all rolling, we'd be happy to come back and provide you guys a report or two just to show you what's available. But at any time, feel free to reach out to Jeremy, Steve, or myself, and we can get you guys some info. Any questions?
You budgeted, but how much is budgeted and how much is it going to cost?
I have that. So there's a one-time shipping fee for all of these. And then there's a licensing for the dash cam. And each division, streets has 31 vehicles, electric is 16, water 11, wastewater 5, PPS 3, there's 4 shared, 3 engineering, 4 CD. So the total, because we already have had some of these, streets was already contracted. So the total is 26,000 with the shipping, and then the annual will be 25. So next year when we have to renew the contract, we'll be bringing it back through the normal process.
Okay. And was it budgeted for community development?
Yes, Scott. We worked with Scott, and they have funds available to do that. Theirs isn't that much,
And how
as a
much
couple.
was budgeted for these?
They're in the like maintenance portion of the budget.
Okay, so it wasn't a specific line item that was put out for that?
No.
Okay. And the same for community development?
Yes.
Okay.
I think this is great for Public Works. I think it's a slam dunk and easy to get through. I guess I don't see the benefit necessarily for the community development vehicles. Is there anything you could, well, I just don't see the same use case as a snowplow or as an electrical truck.
They're
for a
responding to different
Prius or hybrid.
code issues and going out for inspections and if they get calls out. And again, they're also out there in these emergency situations. Scott was out there with myself when we had that microburst last year, and just, if we have bigger instances, we're able to look on the map and see where the vehicle is and deploy somebody quickly or send whoever is there closest to it.
And it's only a few, so it's easier to justify.
Yes. And for the overall, some of the information it provides us and for how long we keep the vehicles, it's just a small portion to help with the upkeep.
Austin?
In the memo, you mentioned one possible downside being employees being uncomfortable with the monitoring system. Have you had any issues raised by employees so far, or is that just a preemptive possible concern?
Just a possible one. I've heard, a little bit, everybody always is very cautious about IT type of things and Big Brother and certain things. So I don't think we're ever going to be able to take that out of anybody's mind, but these are the reasons why we're wanting to use it, to be able to deploy and know where people are.
Okay, but there haven't been any explicit raised concerns by employees yet?
Oh, say that again?
There haven't been any explicitly raised concerns. Okay.
Yeah, this seems really smart. Seems like a good idea to be able to kind of track all that. I see in here it's sort of the $550 per unit cost, and then you mentioned there's sort of the 25% discount we're getting at the moment. Is the $550 with or without the discount? And
That is they based all of this off of the existing contract that we had with the streets. So then we'll have to renegotiate when our contract ends. But so that is included. That's
okay,
the
that
discounted
is
price.
included now. And I just sort of more of a comment, but I mean, kind of once we buy them, we're in, though. It's pretty unlikely that next year we'll say no if we've installed all these systems and paid all the things. So while it's $26,000 this year, it is $26,000 every year from here on out, which I think is worth it, right? Don't get me wrong. I just want to make sure that that's kind of out there.
Comment that I did a sales call with these guys not too long ago, and the software and everything is it's really good and very useful, provides a lot of information. And Dustin, kind of to your point, that was, I explained it to my employees is that nobody would actually have time to sit and just watch these cameras all day long. We're just powerless if something happens. Once they realize that nobody's sitting in a room with them up on a monitor watching them all day, it helps them to be a little more comfortable, I think.
Yeah.
Anybody else?
Yeah, and I would just say candidly, we need to track our assets. We need to know what's going on out there. The technology's available. We should use it. People get used to it.
Yeah, I mean, for me, over the winter, I was able to see when the trucks were out, and I didn't have to text Dave in the middle of the night when I happened to look at it, and it was just able to see what routes were hit and stuff like that. So it has come in handy, for sure. And we'd be happy to, like I said, bring back any more info, or if you guys have questions, feel free to reach out to one of the three of us.
Well, this is something too that I think you could probably integrate with the camera system that we have too, is that you'd be able to use data from one to say, okay, we've got cameras, we can look and see that the southeast side of town is what got hit with snow really bad, so that's where we're gonna go to start.
Yeah, because we do have, we have all these tools, and sometimes I forget, we have the ones on the bridge and throughout the town, so that's Frost Solutions. And I forgot that we could have used them when we had the microburst, because there was one right over there on Millview. But we do have all the different tools, and they play nice together and they're easy to use.
I don't think you're going to be able to get this in the Access camera station.
No.
Right.
Yeah, no, this is individual where we'd have to go
I mean,
in.
you could use one data from one to help with the other.
Oh, absolutely. Yep.
Okay.
All right, thank you.
All right, I'll make the motion that we recommend to council the Samsara integration. Oh, that's not it's just a memo tonight, right? Just discussion, okay. Then we don't need to do that. Okay, we'll move on then to 6.4, which is resolution 2026-57R, approving a charter for the IRP task force. It's got it. Go ahead.
Draft attached to the agenda today. Hopefully I incorporated everyone's feedback accurately, except for the 4 goals. So thank you, Laura, for correcting that and resending that around. I also did forget to put in the due date, which, correct me if I'm wrong, is per IRP. Per the state statute, it needs to be completed by January 1st, 2028. But any other comments or changes to make? And then I know we have members from the public to hear from as well.
Would you like to establish a termination date for the task force, perhaps being upon the approval by City Council of the final IRP?
Any thoughts or comments on that?
We already talked, this is formed just for this purpose.
Yeah, I'd be okay with a termination date. I like flexibility unless otherwise voted by council, I would say, something that gives us the opportunity to extend it, but, have the date that it ends and we either say, yes, continue or let it go away on its own.
Why would you want to have some ambiguous date moving
Yeah.
forward after it's already been after we've already approved what we need it for?
Yeah, totally fair question, right? So I think if we don't see a need for it moving forward, we simply don't take action and it dissolves. However, I can see something coming up perhaps, like something unforeseen. And it just gives us that little bit of flexibility where we don't have to reinvent the wheel if we wanted this to go on for another month or another 2 months,
And we
right?
just vote on that.
And I would say write
At
that
point,
language in there.
Doesn't need to be in the.
Well, what's the opposition to having it in there? I guess I'd turn that question around. Like, we could expressly give ourselves the power to extend it, or we could have to go through a whole nother crafting and drafting, and we'd have to change all the dates, and we'd have to kind of completely reselect an entire committee. Or we could just have the date in there. We could just have it say, if council votes to extend, it extends. So
I would just say to have the end date on it. I don't know why we would have to have both things in there.
I guess, yeah. I mean, I see the value. I guess I just don't see the opposite. I don't see why we wouldn't. Right.
Let's say there is some weird thing that happens that we'd want to extend it. We could just do that later, right? Just say, hey, we would like to amend it.
Yeah, a month before it's supposed to end, we decide we're not going to be finished. It's not going to be done. Then we say we have to extend it.
Motion to amend and then amend it through that process rather than having, okay, I mean, could work. A little more cumbersome, but.
Make it simpler.
I view it the other way. I view it a little less simple, but 6 of one, half dozen.
And I had one question for Alderman Beck too.
Sure, go ahead, Chris.
You'd sent the email and you said that you mixed up a word, but I thought it was the correct word the first time. I mean, maybe I was wrong on that one.
It had the word feasibility in there as opposed to resilience.
I mixed up resilience.
Wait, hold on a second. Let me get the word right.
Reliability, resilience, and adaptability.
I'm reading what's on the draft here is reliability, affordability, sustainability, and adaptability.
Yeah, reliability, not resiliency.
Yeah, reliability. I was going to say.
I said reliability is the word, not resiliency. It's
Yeah.
reliability, sustamentability, affordability, adaptability. I think that Alderman Beck had it right the first time.
I had feasibility in there. I was wrong. I was wrong. I'm gonna own that.
Reliability, sustainability, affordability, adaptability. Reliability is very important.
Yeah, we might need that.
Supposed to be the 4 that are out of our
Right. From your energy policy.
policy.
Gosh, I'm still missing one.
Come on up to the mic, Susan.
Wait, I actually have my hand up. We haven't opened it up to the public yet, right?
Right.
Okay, thank you.
Go ahead, Jennifer.
I just have a question on this and the timing of everything, because we know that there's a second draft coming. And that's what this group is going to be looking at, is that second draft. Because we know if they look at this draft, they're going to find the same things of the feedback that we've already provided them. So I just don't want to.
I have
That's in
indicated to Brattle Group that we would want to, the staff internally wants to see what they've done with the changes that you recommend about a week before the end of May, so that we can, by the end of May or beginning of June, get that second draft back to you for your review, and that would be the draft that the task force would use.
And that's in there too.
Okay, and we can give our comments also at that time.
Absolutely.
As we review it, based on our policy and
Yes,
everything.
please.
Okay, thank you.
Other comments from the council?
We have these right. So I'm looking at the one that I corrected earlier today: reliability, affordability, sustainability, and adaptability.
I was missing adaptability in my own notes too. I don't know.
I think it's right, but that doesn't mean I'm right.
All right, anything else, Leah?
Okay, I wasn't physically at the cow discussion where this was last discussed, but a previous meeting, I did thought that Alderman White had mentioned feasibility. And then I thought that was actually part of the discussion in the last cow, so.
And I meant to pull up our energy policy last time too. I mean, in my head, feasibility is a part of affordability, because anything's possible at time and money, but we're not going to go with it. It's going to be deemed infeasible if it's $4,000 million. So $4,000 million, gosh, it's like.
Well, I think part of the point was also, well, I guess this would fit under affordability, but also, is it something that we're capable of doing in this time and place? But maybe that's just naturally occurring.
I like that you're all thinking about it.
All right, so Bob's in our head. I think it's all right, anything else?
Here it is: resiliency, sustainability, affordability, and adaptability.
We did it.
Okay, anything else here? All right, then I'll open it up to comments from the public.
I hate to correct you, but that's not right. This is referencing the energy policy that you have posted on the website, and that has resiliency, sustainability, affordability, and adaptability.
Yeah, it does. It does right there. You're right.
So since we're referencing in this charter the energy policy, I think it should reflect the 4 components and objectives of the energy policy.
Does it say reliability somewhere else? I bet we have it.
Reliability is like a huge issue.
I thought it was number 1. We said on
we
that.
said it has to be reliable.
It has to be reliable, number 1.
Policy, it's not in the policy.
Is that covered by resiliency? It's resilient to disruptions.
Resiliency
is reliable.
It's got to be reliable to be resilient.
It has to be reliable to be resilient. I feel like, I wouldn't, maybe it's copied in different places, different ways too. That we
I've
changed it, but.
got a suggestion.
Okay.
Oftentimes you'll make a mission statement. Our mission is to focus on resiliency, sustainability, affordability, adaptability by looking at feasibility and resiliency, among other items.
Exactly. We could
Right,
incorporate
right.
Alderman
We
White's
can-
term in there too.
Yeah, we can give direction to our little group here as we see fit and get it all. I think we can have it all.
Yes, and I think that, yes, but consistency matters, so we will match this in here.
We'll match
So
it there.
thank
If
you.
we have to add that in, we should add it in.
Yeah.
If that makes everybody feel better. I mean, I think it is true that there are things that we think of differently with those other 2 words.
It says this approach supports cost control, risk management, and operational flexibility. I feel like a lot of what we're talking about is also baked into, I think we covered it. I think we missed a word. I missed a word. Sorry, I did that.
Well, and it's true, when you try to reference something, we probably should make sure we're referencing the right things that we're trying to use there.
Yeah, sure should. Yeah. All right, other comments?
one other thing I looked at, but now that I read it again and again and again, it makes sense to me. And it was something to do with the Greenest Compact, the Greenest Region Compact.
But that just has to do
That-
with
just one
the
statement.
strategic plan.
Right.
Yeah.
It's
But
just,
as a general comment.
Right, and
Because
that's
that
kind of
made
what
me
I.
pause for a second.
Because I thought, oh, wait a minute, they're going to make a decision here. I'm like, no, but that should be part of where this goes next. And
I
that
was
would
just
be put
pulling
that.
out things that seem to support the
Right.
formation.
but this is relevant to the Greenest Region Compact.
Yeah, because I think it also has to tie back into our environmental commission needs to be part of this stuff moving forward. Else? That was easy. Andrew?
I just had one comment, and I don't know if, it's not a huge deal, but under the task force structure, you have the city council shall appoint 8 members, and one of those is one of you guys being a non-voting member, but then above the decision-making paragraph for I think it's recordings, the Open Meetings Act, maybe, members of the IRP task force made up of 7 members. So it's just contradicting.
Good catch. Okay, I'll make that 8.
So it's 7 kind of voting members.
Right.
And 1 city council member. So
Is it a liaison? Is it a member? Should we
Yeah.
call them a liaison?
If it's 8 members in one spot, it should be 8 members in the other spot.
Sure. So should I change it from, I'm thinking that up above, I'll change it to 7 members plus a city council liaison.
there you go.
Okay, so adding the due date, restating the 4 goals,
Termination date. 7 members in one.
clicking through, 7 members to that top. All right, did I miss anything?
A question. Under deliverables, it says a concise report of its analysis and findings. Are there going to be analysis really going on, or are they just letting us know their findings of where they see the discrepancies of our policy to the IRP? Because shouldn't we be getting the analysis from Brattle Group whenever there's like some of those questions? And maybe I'm interpreting analysis incorrectly.
Probably. I think I'm thinking of it very broadly, and I think that's a catch-all word here that can mean they're analyzing the document, they're coming up with notes, they're comparing it to our energy policy, they're asking questions. That can all be bucketed under analysis, I think, without getting too deep.
Because that's where I kind of see the findings, like based on their findings of doing their analysis and doing all the work in comparison, that they're presenting us their findings with us.
As opposed to comments about what, that goes to the whole nonpartisan situation. They're not supposed to be.
I kind of read the word analyze as read the draft, is kind of how I interpret that. I can see how it could be interpreted otherwise, but it's kind of like, read it and think about it critically. It's just how I view the word analyze.
Do we feel strongly that a wording change needs to happen here?
That's what I think to me, they need to analyze it,
That's fine.
All right, so then next steps, can I make a motion that we approve this with those amendments and push it forward to council and have the final draft there?
So moved.
Motion by Lancy, second by Beck.
All those in favor?
All those in favor?
Aye.
Aye.
All opposed?
That was a lot easier than I thought it was going to be. Okay. Let's move right on to project status. Laura?
Organized here. Taking my notes on my pages, and now they're all out of order. Okay, here we go. I sent you earlier this week an Illinois Municipal League request. We know things are moving very quickly with the Build Act, different pieces of legislation. And IML has a model resolution that they have asked communities who, not that they're opposed to the ideas that are a part of the Build Act legislation, but just to the fact that they're taking away local control over those, and it becomes a slippery slope of saying that a community is no longer in charge of its own residential zoning. And so I just wanted to get feedback from City Council whether they're supportive of a resolution of that kind or if they wish to take no action.
I believe that would be a pretty in-depth conversation because my assessment based on our previous conversations is I don't know if there's a strong consensus on council on how we feel about the Build Act right now. I think we might be, I don't want to speak for folks, but it's my impression that we're kind of divided on that. I hope I'm not misspeaking.
We can put it on a future agenda for discussion.
Yeah, it needs to be. We have not talked about this at length at all. And more importantly, I think the thought was last time that the bill would change prior to it passing. It looks like it really hasn't changed based on what I saw last time I checked. So yeah, we need to talk about it. And I think now that the bill is a little more towards its final state, it looks like if they're not going to change it too much, we definitely need to talk sooner rather than later.
I think it's only now going into committee, though.
Sorry, what?
I think it's only now going into committee for discussion as well, though. So I don't think it's entered into that process yet.
I think it went to executive committee,
Right.
which, whether things could move from there. It's not as safe as it going to the rules committee where you're pretty sure then that nothing's going to get done in the current session. I think there still is a strong possibility that this being a very signature legislation for the governor, that at some point things could move very quickly.
Okay.
The other is something that you may want to put on a future agenda as well. I forwarded to you a request from someone for an honorary street sign in memoriam for a member of our community who has passed away. During my time here, this is the first time that I've received such a request under those circumstances. And so we probably need to put an agenda item to talk about what our policy should be in that regard, because once we have one, I could imagine that we would have additional requests, unless you are in agreement, one way or another, as we sit here today.
I agree, the slippery slope. When you say street sign, are you saying name the street after him, like?
Those brown signs.
Those brown signs that you
Okay.
see in Chicago under the green
Underneath,
real
yeah.
sign.
I didn't know if it'd be a separate sign.
Yes.
In memoriam or whatever.
Yes.
Woodland Hills Road, honorary Chris Sofa Way.
I think formulating a policy might be worthy of a discussion. Sorry.
My concern, especially in that area, is it's already congested with cars, that's going to just be another distraction. And so as I think about this of long-term and sustainability, is that something where people are going to be distracted with now all sorts of signs and then not paying attention to the signs that we want them to pay attention to?
I think we have a proliferation of signs. Sometimes I thought it's not the Windmill City anymore, it's the city of signs. North River Street's the biggest one.
I mean, no disrespect to anyone, but if I'm ever in a car accident and perish in an intersection, I absolutely do not want that street named after me. I would much prefer to do something positive in the community for this individual, a park, a tree, a bench, anything else. That's just me. So,
especially being a teacher, I'd rather see it be a scholarship.
Even better. Yeah.
And further to follow on that, we unfortunately have some roads where the number of signs on those roads might begin to get long, which is sort of a macabre thought, but we know it's the case from looking at our crash data. So I think thinking carefully about this so that we can be fair and respectful to the families, I think warrants a further discussion.
Okay, on to,
oh,
I'm sorry.
I would like just say, it's been a very interesting meeting. I appreciate all the debate on the various subjects, and I think the council has handled tonight's meeting very good. But what I wanted to share was in my role in Chicago as chairman of the Chicago Metropolitan Agency for Planning Council of Mayors, I have been advised that in there and talking to some other mayors in the region, that this state bill that we just debated briefly here about taking away our zoning powers, Batavia appears to be a target in that conversation. And I say that because I'm told we had people out here wandering around our town, looking at the residential subdivisions and asking such questions as, who's got a big backyard? Or who's got a side yard that could be redefined? And I've even had, I'm told, some folks came down and wanted to look at some of our water and sewer maps as to, wanted to check and see where pipe was and whether there would be pipe there. So there's people doing research now about thinking if this gets passed, gee, I'll be able to buy this house on this street and turn the backyard into 2 sublots and build smaller houses on them. Well, I can tell you that I think if that happens, we're all going to hear some real screaming and howling from some of the neighbors in some of our residential areas about you suddenly coming in here and changing this around and cramming and jamming a bunch of stuff in here. So I've been sharing with our state legislators, and I know some other mayors have also, that the state's got to be very careful with this bill as to what they are going to allow and not allow. And I think this is something that we should probably keep on our priority in future council committee meetings, that maybe I'll be able to give a report or some of the staff will be able to give a report as to where all this is going, because this is kind of a little keg of dynamite, and it could blow up in the wrong way if it's not handled in the right way. Because you think about your own wards, and I know at least, I look at who's sitting here, and I know at least 3 of you I have been told have people out nosing in your wards about wanting to see where they can build things and how easy or hard it would be to do that. And I can imagine the playback you will get from some of your constituency if suddenly they find out, oh, gee, some guy wants to go down the street and build 2 houses in the backyard because it's a big backyard and they can retrofit them in there. That'll be a tough one for some of us to buy into, and I think we could fill the room here a couple times on those debates if it comes about. Hasn't happened yet because the state hasn't adopted the law, but they're down there now, I think, trying to figure out a way. They've gotten themselves into this, and suddenly all these new problems are coming up in their face. So just put that on your head that this is something we got to watch fairly carefully.
With you on that, I think the thing that opened my eyes was a couple of the articles I read about the sewer availability and being able to handle that in certain areas which are, like us, landlocked. And we only have so many more, not 1 million, but we have a very finite amount that we can go up in that area where that's going to be a really hard thing to solve.
Hopefully, some of the language in the state law will address some of that. And it's being suggested to the governor's staff that they need to get deeper into this thing before they go throwing something on the legislative table and say, let's approve this.
Jim, did you have a question, comment?
Yeah, really just a comment. It is weird that we're not hearing more from the state about this, given the level of change. You think there'd be like a town hall, you think there'd be something that would, at least prep municipalities for it. So I think it's a really good indicator that this really has not been thought through as much as it should be, because they're not trying to sell it. They're just saying we're going to do this. This is behavior they've shown before at a state level over the years. And to be fair, I never really started keeping track of it until over the past 3 years. I'm sure it was the same thing going on under different administrations. It just seems the state of Illinois tends to operate under a different method and a different approach to legislation than we do as city council. And so we have to really make sure we're checking them more than you think we would have to, just based on my prior observations of that organization. So.
Just wanted to report that Beth Walker and I are going to be from Main Street, and I will be meeting with the new CEO, Executive Director of the Kane County Economic Development Corporation. His name is Michael Casa. He comes with a great deal of experience in economic development. Most recently, he was the Economic Development Manager for Sugar Grove, and Beth and I will be meeting with him to discuss our Recast Leaders program, where we are aiming to recruit small-scale manufacturing businesses to our downtown. Beth went into that a little bit during her last presentation. In the police department, multiple staff members, including our community relations officer Webb and Comfort Dog River, attended the Alice Gustafson Special Olympics Young Athletes event on Thursday, April 23rd. In Public Works, Friday was Arbor Day, and the Streets Division coordinated a tree planting at 209 South River. It's a Park District property that they recently acquired where the house was removed a few years ago. And the plan is to incorporate that into the Philip B. Elfstrom Greenway project that they are planning there in the future. And continuing with the Arbor Day celebration, Streets packed 475 trees to be delivered to the Batavia school fourth graders that day. And as well, our Batavia Environmental Commission hosted a tree sapling giveaway in front of City Hall, and they gave away 600 saplings from the front of City Hall. The Batavia Park District received a $200,000 grant from Maura Hirschauer for the H. Michael Wild Mahoney Creek Tributary Project. The Park District and the city have an intergovernmental agreement for that project where we split the costs 50-50. So we would be receiving a $100,000 credit on our portion, and that is in conjunction with the $535,000 GIGO grant that we received. So lion's share of that project will be paid for through grant funds. Our water department is doing hydrant flushing, and they're moved over to the east side at this point. Electric also last week was just in the final stages of commissioning the equipment upgrades at the main substation on Shumway. And Steve, we're in service now?
It's called We're Soaking.
We're soaking, okay. So we're almost there.
It's energized and it hasn't blown up yet.
Right.
I've heard that's good news.
Oh, that's how it works.
We welcomed 2 new team members this past week. Bobby Rinaldi is an engineering assistant, and then also Colin Bogas is a PSI medic. And Bobby's onboarding also marks the successful close of a long-standing vacancy that we have had in engineering ever since Daniel, I think, moved over to electric to be their engineering technician on that side. HR has also been doing a great job of recognizing various groups of employees within our organization. And last week we recognized the administrative professionals with appreciation messages to them, as well as cards and gifts inside the cards. But I just wanted to mention that that's not a position that we talk about much here at City Council, but they really are a backbone of the organization, performing a lot of those services kind of behind the scenes, but they also are on the front lines when it comes to answering the phone about issues. And, you know, for issues like the Groot contract not having stickers, boy, those people really took a lot of abuse about that. But we're very proud of our administrative staff and the level of customer service that they give to our community. I get letter after letter about their knowledge, their helpfulness. Elise, our receptionist, even if it's not something having to do with the city, she'll be like, well, let's hop on the internet and see how you do that. You know, I can't answer your question, but let's get you to the place that can. So just wanted to say thanks to HR and thanks to all of our administrative assistants who keep this city running. And that's all I have.
Does anybody else have any others? we need a motion to go into executive session for purchase of real estate. Discussion. Motion by Lancy, second by Solfa. All those in favor? Aye. Opposed? Me? Okay.